When I look in the mirror, the first thing I see is all of my insecurities. You know, oh, that scar looks dark today, or my eye's watering today. Nothing on my face is symmetrical. My nose is crooked. I notice all of the little things that most people don't have to notice.
This program examines medical conditions and the procedures involved with treating them. Due to their graphic nature, viewer discretion is advised.
My left eyelid doesn't work like a normal eyelid. I have a muscle deficiency. It's like a droopy eye. I'd rather not go out and meet people. They're gonna be looking at me and asking, what's wrong with your eye? I just thought I was done with everything that I wanted to do with my eye because there wasn't really no change from the other surgeries. I've had 2 other procedures done before with little to no results. And I was trying to mentally be okay with that and just trying to live with it and even with the pain. So I am just looking for a solution to ease the pain of that eyelid.
What pain are you feeling right now?
On my eyelid, when my muscle is strained. Because, I get that pain in my eyelid, when it's strained too much. And, I stare at a screen for work all the time. So I am an accountant, so it causes me a lot of pain just staring at a screen. My left eye gets so strained. I have a bad headache coming from it. I don't think I've ever pictured my eyes looking the same and getting a somewhat symmetrical face. And I feel it would mean a lot.
Yeah.
I would feel more confident.
I've noticed you always tend to cover it up.
Yeah, with my hair.
Yeah.
Because my face is not symmetrical. And then you can see it more. I try to hide. I hide behind my glasses, behind my hair, or when I look at people, I try to turn my head or be at an angle where they probably won't see it as much. I can't even imagine. I don't even know what it would look like if it did look at least kind of the same.
Yeah.
Yeah.
I really hope that for you.
Thanks. I don't want to cry.
No.
I'm glad you're here.
I'm really glad to be here.
Thinking about just living with the pain with the rest of my life is definitely, it sucks.
I'm really excited for you. I feel really hopeful that, he'll be able to do something about it.
Yeah. With age, it's getting worse. I'm taking pain meds just to get by, and where I can't really see from one eye. I guess just thinking or knowing that there might be something that somebody can't do. It makes me emotional.
I know.
So I have a patient coming in. Her name is Neris, and she has congenital eyelid ptosis. Basically, when she was born, for whatever reason, the muscles that are responsible for lifting and opening your eyelid didn't develop. When I look at her photos, I notice the immediate asymmetry of her eyes. Droopy eyelids can be common, but Neris has a severe version of it, and that's often the case when people are born with droopy eyelids. But these eyelids are extremely complicated. The delicate finesse nature of eyelid surgery makes it incredibly difficult to treat. We're talking about muscles that are a millimeter or 2 thick. We got to be able to navigate through these areas, and there's really no room for error. Hello.
Hi.
Hey, how are you?
Good, how are you?
Long time no see.
I
I'm
know.
gonna go in for the real thing. Here we go.
We've already got real personal.
I know. So, fill me in. I mean, you look awesome. So, fill me
Thank
in.
you.
What's been going on?
Well, I feel it's definitely a lot more open, and I haven't gotten that soreness at all, actually. So that's definitely a plus, because just getting that pain was just a lot.
I mean, I love to hear this. This is exactly why we were doing this stuff. So let's do a little exam. Do you mind taking off your glasses? There we go. Excellent. I'm looking at how the bottom eyelid lines up, how the top eyelid lines up. I'm looking at it as pretty darn even up top. Then you're able to close completely. I mean, I am very happy for you. This is as great a result as I can hope for And I think it's just going to get better with time.
Thank you. I really appreciate what you've done for me. It's definitely made a big change in my life. I am very, very grateful of Dr. Panossian. I never in a million years would have thought that I would have had an opportunity like this. And here I am.
I have neurofibromatosis type 1, or NF1 for short, that causes tumors to grow on the nerves anywhere throughout the body. This one started to grow, I want to say I was about 8, 9 years old, maybe 10. My parents were always told, it's not cancerous, we're not going to touch it. But as an adult, it got to the point where the doctors were like, okay, this has to come out now because it did so much damage and took out this entire side of my jaw.
I remember when you had teeth, how much it hurt and how much pain you used to have.
Yeah, never knew how much pain I was truly until they were gone.
Okay, let's pretend I was the genie in the bottle. You get all your wishes, all right? We got 3, at least.
Okay.
Okay, what's number 1 on that list?
Number 1, I would say if you can't take out the indent that I have over here and then get rid of whatever bulges here, you know, try to normalize the left side to the right side.
Okay, I'm glad that is your number 1 because I think that is, you know, an important goal. What's number 2?
How the ear sticks out, I was always told I had big ears as a kid, and I grew into them.
Yeah.
But it kind of feels like this one's sticking out again, and...
Yeah, I agree. The left side has some room for improvement. So again, try to give that fold back more and get it pinned back a little bit more for you so it sticks out less. I think that's a valid goal. Should we do a quick exam now?
Yeah.
All right. People with this type of syndrome have lumps all over their body and faces. And sometimes when they get really large, they get really distorting and invade into nearby structures and cause real havoc. And this is exactly what happened for Patrick, and I just hope we can help him with that. So you can kind of see this is the area that's excess, and then it's very deficient here. Go ahead and open and close your mouth for me. Bite down for me. Relax. Now, when you first did this surgery, was this tissue all the way up there and now it's kind of fallen down, or what do you think?
No, it's kind of always been...
Kind of bulky
small.
there?
Yeah.
Okay. It's a pretty noticeable difference where it really dips in. It's kind of a massive crater. And what I'm worried about is that the facial nerve that controls all your motor function to your face, this is right in the area of the divot for him. And if I cut the facial nerve, I could paralyze his face. I will look for it every step of the way. And you know, that is to me, you know, one of the major risks that we have to be mindful of. A major focus on my end is going to be to avoid that. Trust is critical, and it's a two-way street. We're taking a major commitment together. And last thing I want to do is make him any worse off. So I got to be very laser focused and do my most meticulous work to make sure I don't injure one of the facial nerves. All right, well, I think we have a great plan. Look forward to doing this for you, and hopefully this is it.
I'm feeling really good about this. I'm excited. I'm nervous, but I'm excited.
Good. And Vanessa?
100%.
Okay, love it. All right, bye guys.
Good to meet you. Thank you.
You too as well. Bye guys. Yeah, of course.
I know the risks, but the risk is very worth it. I just got to keep my fingers crossed and pray for the best. Hey, Doc, how you doing?
How's it going?
Going all right.
Well, thanks for making it again.
Yes, thank you for having me out again.
Yes, of course. So you look great.
Thank you.
So-
I feel good.
You feel good?
Yes.
Awesome.
And the face just feels great. It looks great.
Awesome. Yeah, the contour on the face, so much better. It's so much smoother than before. And let's take a look at the ear. The fold is definitely better than before. You look really good.
Yeah,
Yeah.
it feels better.
Awesome.
It looks better. Lots of people tell me that.
Awesome.
And it's really good to hear.
Yeah, all good things.
All right.
All right, well, if you need anything else, please let me know, and don't hesitate to reach out.
Thank you so much,
Yeah,
Doctor.
absolutely. All right, we'll see you next time.
All right. This experience has just been amazing and wonderful on so many different levels. I am so grateful to Dr. Roostaeian for being able to do this for me and help me out.
When I get too hot sometimes, the bigger ones that I have, they sweat and they become more painful. And it's like,
I'm sorry.
like if you have a rash and it itches, that's what it feels like sometimes when it gets too hot.
Is there anyone that like hurts specifically more or like?
My chest and my torso hurt the most, but like the
Yeah.
twins, you know, they hurt the most sometimes because my shirt will rub them. And
Oh,
the
yeah.
big one right here always hurts on my neckline, or the one right there. Like I can't wear hats without them hurting, or sunglasses because the
Yeah.
sunglasses pushes pressure on them. A brush across it just the right way. It just is so painful.
Okay, so I understand you have neurofibromatosis, right?
Yes.
Okay.
I was born with it. I was
Okay.
actually born with some fibromas.
You did?
Yes.
Okay, okay. And how many surgeries have you undergone since then?
Maybe 4 just to have little ones removed, but they were removed incorrectly. So the ones that I did have removed have grown back around the scars.
Okay.
And as I got older, they became more profound when I was pregnant, and they were more noticeable. And
That is a frequent theme that comes
Yeah.
up. I was totally controlled until I
Yeah.
got pregnant, and all of
Yeah.
a sudden it just exploded.
Yes.
Tumors everywhere.
Yeah.
When you're pregnant, you have such a flood of hormones
Mm-hmm.
throughout the body. Those hormones can also impact this condition. So let's move on
Okay.
into a little bit of an exam.
Okay.
Let's see what we're
Okay.
up against. If you want to pull your hair back a little bit, I'm just going to kind of come in and take a close look at all these areas. And we got a big one here. In my exam, I'm seeing she's got various types of tumors. You got these very large ones. Some of them look very angry on the surface, red, raised, also very tender when you touch it. And obviously it goes down
Yeah.
onto your chest and probably up onto the
Yeah.
abdomen and all that. Then you've got these little flat ones. And there's hundreds of those little flat ones almost coalescing with each other, kind of combining to form like this general textural change in the skin. How many there are, how big they are. Her photos leading up to this didn't give it justice. It is a very severe problem. I think we can get virtually every one of them on the face and the neck. Sometimes I have to make sort of judgment
Yeah.
calls during surgery about leaving 1 or 2 behind
Okay.
if I'm creating too much of an injury
Okay.
to your skin.
okay.
Now, there's different ways of taking these tumors off. The big ones have to be cut out, but you have lots of little ones.
Yes.
So we do something called electrodesiccation. Electrodesiccation is basically burning these tumors
Okay.
or cauterizing them. What we do is use a device that will burn the tissues. It's got a little needle tip
Okay.
probe to it. We burn the tissues and we move to the next one, and we do that pretty rapidly.
Okay.
There is another thing that we end up doing during surgery, and that's a combination of electrodesiccation and excision.
Okay.
So some of these tumors are like an iceberg. On the
Yeah.
surface, they're kind of teeny, but you don't even get the sense of how big that root is underneath. Now, when we do electrodesiccation, that
Yes.
tumor swells aggressively if there's a little bit left behind it. So much so that I can see it happening
Okay.
when I do the treatment. So when I see it, I kind of realize, okay, there's a root under this. So I will take a little tiny curette, which is kind
Okay.
of like an ice cream scooper.
Okay.
And I'll go right through that electrodesiccation wound and I'll scoop it right out.
Okay.
And then all of a sudden, magically, it goes flat,
Oh,
just
wow.
like that.
Good job.
Very excited.
Excited?
Yes, very much so.
Ready to do this?
Yes.
Yeah.
Let's go.
Excellent. So let's do that.
Okay.
Even though some of these tumors might seem really tiny on the surface, we really don't know what it's like underneath the skin. Doesn't mean that it doesn't have this big giant root underneath, kind of like weeds. And if you leave one of these roots behind, then there's a potential for that tumor to come back. I need to get all of it.
It's gonna happen.
I'm so happy for you. I'm gonna cry. I'm gonna cry.
I know, you keep telling me not to cry.
I know, I'm going to.
This is something I wanted for so long. Sorry. It's like once something that you wanted your whole life and you never thought you'd get it and it's handed to you. I'm just very thankful.
It's gonna be great. You're gonna do beautiful.
Well, look who's here.
Hello.
How are you?
Good, how are
Bring it in for the
you?
real deal here. How is
Yes,
it going?
Good.
You look awesome.
It's because of you. Thank you. My collar doesn't rub certain ones anymore that hurt me before, and
And then you called one of them the
the twins, the one that was right there that you got, because
Oh,
there
my
was
God.
two of them right there together.
Oh, I can't even remember
Yes,
what it looked
the
like at this
twins.
point. That's so good.
They were like together, so.
What about things like you were feeling before?
Oh, like the
itching,
one behind my
scratching?
ear, that was really bad. I can wear sunglasses and with no problem. I can wear hats, headbands, anything like that. The ones that were hurting me the most, they're gone.
Yeah.
Less pain.
Tell me, what's the last few months been like?
It's been life-changing. I'm happier. I don't have as many looks as I did before, and I couldn't be more thankful than what I am now to have all this. And I can't thank you enough. And this has just been something I wanted, and I can't be more grateful. I thank you so much.
When I look in the mirror, the first thing I see is all of my insecurities. You know, oh, that scar looks dark today, or my eye's watering today. Nothing on my face is symmetrical. My nose is crooked. I notice all of the little things that most people don't have to notice. I don't put makeup on every day because it is a lot of work. It sucks, like it's a long process. I use the color corrector on my scars to kind of take down the redness. My eyes is definitely all mascara. Sometimes I do eyeshadow, but the thing with eyeshadow is it's hard because this eye doesn't close. I actually avoid lipstick at all costs because my lips are not symmetrical, so then it just looks funny. I was only 5 when my accident happened. A dog attacked me. I remember being thrown against the wall, and when I had started crawling away, the dog had grabbed my leg and pulled me back. I do remember my skin flopping in the air. My face felt cold. I do remember like looking at the dog, and I remember like seeing the blood like in its fur. I was told that, you know, the dog had ripped off the tip of my nose, like the cartilage part, and that somebody was sent to go retrieve that piece and bring it back to see what could be done. I think back on waking up in the hospital, just being absolutely terrified, looking in the mirror for the first time. It was purple skin, bandages, absolutely terrified.
So tell us your wish list. If we were the 2 genies in the bottle, I guess.
You might be.
Let's hope we are. Like, what would be your #1 wish?
To start off, it would be my eye. It's just like constantly watering, super droopy. I can feel the pain and the burning in my eye from the tears. I guess additionally too, like my dream as a little girl has always been like a perfect nose.
So let's talk about the eye. Could you close your eyes as best you can, nice and comfortably? There you go. Now just follow my finger with your eyes here. Because of her facial paralysis, she's unable to close her eyes fully. And eyelids are incredibly important to protect the eye from debris hitting it and scratching the cornea, losing your vision, drying out, tearing. Okay. So you have a little bit of a drooping of the lower eyelid. It's the result of your nerve to the face was injured. Now, as far as the rest of the facial paralysis goes, the immediate thing that you see is the smile is missing. There's no movement happening at the corner. What I would like to do next is talk about what our plan should be. Okay. For the eye, when you have paralysis, what we do is we go back in there and we have to bring it back up. And the plan is to take a little tissue from the roof of your mouth and then insert it into the space on the inner eyelid. And then finally, most people think of it as smile surgery. We use the temporalis muscle, which is another biting muscle, and pull it through the cheek and reattach it to the corner of the mouth and animate the smile.
So in terms of the nose, I want to shave down the bump a little bit, support the tip, get the nose as straight as possible by correcting the deviated septum. That's on my end.
Okay, good.
So I don't know, how do you feel? What do you think about the plan?
I'm excited.
Yeah, are you?
Yeah.
Awesome.
I do get a little afraid when I have really high hopes for this surgery. If this doesn't work, then how is one supposed to move on with that?
This is probably a bigger surgery
Yeah.
in some ways, but I think really meaningful for you, I hope.
Yeah.
Josie's had a lot of surgery. She's got a lot of scar tissue. She's got a devastating injury. Quite honestly, we don't know what we're going to encounter until we're there.
This surgery is absolutely going to take several hours, and it's going to be a major challenge. Josie.
Hello.
So good to see you. You look great.
Hey, stranger. You look great.
The tip, is a lot better supported. Really happy to see that. It looks beautiful, and it's just gonna get better and better from here. You had what we call a major C-shaped deformity. It was really curved. Now it looks perfectly straight down the middle. Really happy to see that. It looks beautiful, and it's just gonna get better and better from here. There's still some swelling there, but already it looks great, and it's awesome to see that.
Give me a big bite and relax. And look at that tug right there. You got a lot of good movement there. The immediate thing that you see is the smile is missing. There's no movement happening at the corner. Now give me your best smile. Excellent. That is a smile. You have a smile. That's really
It's beautiful, and
fantastic.
it's only gonna get better from here.
Yeah.
It's really cool to see.
Yep.
Yeah.
Yeah. So what's new in your life? What's been happening since the time of surgery?
I'm getting married.
Oh, well, that's a big one. Let's see it.
Oh my gosh.
Beautiful ring.
Wow,
Did you help design it, or
congratulations.
I did,
Yeah.
in a way.
In a way.
I told him what I wanted, and he did the thing. So I'm getting married to the love of my life, and I'm feeling happiness, joy, all things positive. I'm just extremely thankful for the both of you. I'm extremely grateful from the bottom of my heart that they did an amazing job. I definitely want to use my smile at my wedding and show everybody how strong I am and that I've made it this far with a smile on my face. Well, thank you guys.
Yeah, of course.
All right, let's bring it in for a big hug.
Triple hug.
Triple hug.